Hi, good evening, everyone. It has been a long time without posting videos here. I've been busy on the other schedule, so I've come to talk about some opportunistic infection in HIV clients. What opportunistic infection? These are infection which actually does not normally affect a healthy individual. They target an individual with a very weak body immunity, which is now very common in HIV. So that's the reason why we are calling it opportunistic. And HIV virus doesn't kill you directly, it just weakens your body immunity, and now it will give access to this opportunistic infection we are going to talk about to harm you or to kill you or to weaken some of your body organ. Number one of the opportunistic infection in HIV client is tuberculosis. It is caused by bacteria called Mycobacterium tuberculosis. So it's one of the opportunistic infection in HIV client. Actually, normally those bacteria doesn't affect you when your immunity is stable, unless your immunity has been weakened by other factor or by HIV virus. So it's one of the opportunistic infection. And what are the signs of this TB? For clients who are on ART or clients who are on medication for HIV, one thing you should know that if you start having cough which has taken you 1 week or 2 weeks and you are giving it treatment but there is no improvement, that could indicate you might be having that opportunistic infection. Another one, you feel dizzy, fever which is on and off, more especially at night, and you sweat too much during night time, and there will be loss of body weight, or loss of appetite, those one. So those are a few signs of TB as one of the opportunistic infection in HIV client you should know. If you start having any troublesome cough, make sure you go and get checked. The second one is cryptococcal meningitis. Cryptococcal meningitis is caused by fungal called Cryptococcus neoformans. It affects actually your central nervous system, and while some of the signs are hallucination, you start seeing things which does not exist. Two, start having this headache. Three, you start having this forgetfulness and some kind of mild fever. Those are the signs, and cryptococcal meningitis is one of the opportunistic infection in HIV clients. Another opportunistic infection is intestinal parasite like Entamoeba stoltica, Entamoeba coli, Fasciola busci, and Terribius vermicularis. You start having those intestinal parasite infestation. That's why some of these people will always have diarrhea time and again.